Good morning, everybody. Sorry for the slight delay there. And I'm really pleased to be with you. I'm also really glad to be second on, because that was a long line of speakers that you're having to listen to. So I hope that you will have a very interesting morning. Indeed, we do have a challenge in front of us. My role this morning is to talk to you about engagement, about involvement, about making sure, as Sunil has confirmed, that that actually is right at the centre of everything that happens in the months to come. Representing Healthwatch is what I fundamentally believe is the right thing to happen. And I think collectively in the room we have to make sure that that is what happens and that it's a real conversation that takes place. So I prepared you a short presentation which I think just sets out exactly why I believe that is the case and how I think it should happen. I want to start off by just reminding us of the very obvious, that every single person in this room today actually works with people, talks to people, is involved with people every single day, whether it's professionally or in communities, and we absolutely have a real sense between us of what matters. We know the experiences that people have, we understand them, we've probably experienced them for ourselves. So many of the solutions and a lot of the thinking is within ourselves. We know exactly what needs to happen, but sometimes it's difficult just to get the traction to actually make those ideas and those conversations really make a difference. And I think that's what I'm hoping that the Success Regime, you could say it, would accelerate. And of course we are all customers of the NHS as well, and the care system. So again, we've got those very personal experiences of what it's like on a day-to-day basis to attend those services, and we've all got ideas, I'm sure, of how those things could be better. Healthwatch Cumbria is listening to people every single day. We're talking to thousands of people, we're hearing their stories, and I know you can't read that probably from the back, but let me try and bring some of that to life for you. This first slide records some of the negative things that we hear. And some of it's very, very simple, and some of it's a lot more entrenched. So the first story there is about somebody that's told us that it took them 3 weeks to see their GP. Eventually, when they get into the system, every time they went, they saw a different person. And that meant, of course, they had to tell their story again. It's not the most efficient way to manage things. The second one, very simple, somebody in hospital reporting that the hand wash was constantly empty. And obviously when we see notices all around the hospital about making sure that cleanliness and hand hygiene is of paramount importance, and yet the container is empty, a simple solution which would have a massive impact on infection control. Somebody else telling the story about being bounced around between services, needing to go for a scan and an x-ray, but yet the communication between those two services just not being quite right. And that meant that things didn't go, that their experience of everything needed to happen just wasn't right. Other people telling us about the attitude of staff not being as good as it could be, about feeling that they've been treated rather abruptly. And again, maybe that's a training issue, maybe it's simply because of the pressures we have that Sunil has already alluded to or actually referred to in terms of recruitment. And just this week I heard of a story of an elderly gentleman that was required to attend hospital, asked to attend at 12 o'clock, was finally seen in the clinic at 7 and was discharged at 11:30. Now all of us in the room would know that these things are not acceptable and not the way that we would run expert services. And yet these experiences are all too common, and we need to make sure that they're absolutely dealt with at the coalface, so to speak. However, there is some good news. And I'm delighted to be able to tell you that people tell us that there are some really good experiences that they have as well. And here's somebody saying that the appointment system at their medical practice is really, really good. And if they've had tests done, that medical practice phones them back and tells them the result of the test so that they don't have to make a subsequent appointment to go in, which, as we know, could take some time. A really good story here of a gentleman reporting about his wife who broke her hip, and that everything about her treatment ran smoothly, she felt very well cared for, even said that the food was very good. And as we all know, it's that holistic approach to looking after somebody's well-being that's much more likely to achieve fabulous clinical outcomes. So even the food matters. Somebody else reporting on a broken arm and just saying again that the systems did communicate well. and that things did work as they would have expected. And this last one about breast clinics being really, really good. And that one really strikes me as really important, because women who are actually attending a breast clinic are probably at one of the most traumatic times of their lives. And yet, if they're actually telling us that it's a really good service, then we need to properly understand what it is that makes that good. What are the criteria of great that people who are at the very depths of their despair in terms of their personal health can still say that was a good service? We need to really get inside that and understand that. So what I'm really talking about today is that listening and understanding some of those examples I've just talked about give us an awful lot of the clues that we need in order to make things better. We absolutely have the opportunities there. We just need to make sure that the engagement works. And the question we need to ask is, are services as good as they possibly can be from a patient perspective? Are we absolutely listening and understanding what the messages are within those experiences, some of which I've talked to you about today? However, since I've been working for HealthWatch, I have come across some anxiety and some concerns from professionals within the service about exactly how to start that conversation, how to enter into the engagement. There can be some reluctance that, do you know what, we haven't quite worked out what the answers are yet. We don't really know what some of the solutions are. We're not sure where we are in the decision-making process. And so we really don't think we're quite ready to talk to people yet. Well, I fundamentally believe that it's never too soon. We absolutely have to start that conversation right at the coalface, right whenever the opportunity strikes us, right in the face. Don't worry about not having the answers, because as we've already heard, this has to be a collective approach to seeking solutions. Everybody has to be involved at the same time. We're all partners in this together. And the other thing I want to remind you is, and again we've heard Sunil talk about this already this morning, people who are our customers within the health and care system absolutely understand we are the drivers that are of paramount importance. We know that clinical outcomes have to be achieved, excellent clinical outcomes have to be achieved. We know there are national standards. We absolutely know that there are massive financial deficits and also huge problems with recruitment. We know these things. But what we need to do is have the honest and transparent conversation about exactly what that means for the services and what the implications are. The conversation has to be honest and transparent from the beginning. And people need to know the warts and all situation, so that when they're having a conversation, they know the full picture and absolutely understand why that picture is the picture. So HealthWatch Cumbria is fundamentally and absolutely committed to making sure that this continuous conversation with people takes place. But also, really importantly, I need to say to you that HealthWatch Cumbria is not the only vehicle to allow that to happen. You know, I'm absolutely delighted today that we've got Carol from the emerging Voice for West Cumbria Healthcare, that Siobhan's here and Mahesh from the Hospital Campaign Group, that Caroline Otley's here from the Third Sector Executive, that many other representatives of local community groups are here, because it's only through that network that we will absolutely achieve the full and widespread conversation that needs to take place, that goes into all the nooks and crannies of Cumbria. You know, I drove across the hills to get here this morning. It's a lovely drive. It absolutely reminds you of how remote parts of our county are, especially when you have to swerve to avoid the cow on the way. And it's very obvious that when you're driving across the hills how remote those particular areas are. But actually many of our communities are remote, but not so obviously remote. They're remote because their access to services are challenged, because the infrastructure that we have in Cumbria is not up to standard everywhere, because they're worried about how they're going to get to a service that they absolutely need at a real time of need, and they don't know what the answer is to the question. So remoteness and access are absolutely important and a fundamental part of the conversation that we need to have. And that's why it's so important that this is, as I say, a joint effort. We make use of every opportunity we've got, every network we have, that we get the message out that we want to be involved in that conversation. We need to think about all the staff. You know, what's going on within the organisations themselves. We have representatives here from some of the staff groups, and you know, that is another essential part of the conversation, because the people who are working in the services, especially right at the coalface, know exactly what needs to be done to improve things. Right, really simple things often make all the difference. So what I'm suggesting you today is, as these options emerge, and we've heard that they have to emerge quickly, is that we test those options against what people are telling us are a very good idea, what their sense of a great service is. So we look at, they're telling us these are the criteria of good. How does this option help us to deliver that? And we start to get a better picture of how we can achieve all the things we need to achieve together. So I'm talking about a partnership, I'm talking about a joint conversation, about everybody being involved from the start, and about it being honest and frank about what needs to happen. So in terms of this accelerated conversation that we're talking about in the engagement programme, some thinking has already gone on about what that should look like. And I can stand here to you today and make a commitment that there will be several levels of conversation and engagement sessions right across Cumbria, and I mean North and West Cumbria, into those nooks and crannies and those communities that I've talked about, making use of all the various networks that we've got. But for sure there will be 4 large planned workshops. There will be several, probably 16 small-scale market town type events. There will be many smaller conversations that exist using the same questions, the same framework throughout Cumbria. And there will be sessions internally within the system, within the hospitals, within the various other community settings, so that we make sure that everybody gets a chance to have their say. And Healthwatch Cumbria will be absolutely integral to making sure all of that happens. And I want to say, and I would like to think that we will absolutely make sure this happens, that engagement will be inclusive. It may mean we have to do some targeting to really encourage some of those people whose voices are not always heard so loudly to come forward and feel that they are also being listened to. It will absolutely include community representatives who know how to reach out to some of those people. It will be internal and external, so within the system and within all communities. And I think all these sessions need to be facilitated by people who really know how to bring out the ideas, bring out the solutions, help people to feel encouraged and really speak their mind and not be worried about saying what they think or telling us about their experiences. And as I've mentioned, we use a structured framework, so no matter where those conversations happen, the analysis makes sense. We can absolutely draw out the themes and trends and really understand the things that absolutely need to be fixed. And where possible, we will extend the conversation through social media as that's appropriate and for those people that feel able to do that. And we know that throughout all of this, and again, Sunil has alluded to this, people will constantly say, how can I be involved? I've got a story to tell. How will I know I've been listened to and what difference it's made? Will somebody come back and tell me that my experience has made a difference? Because that is really important. People tell us that every single day. And what is success? And I would like to put it to you today that actually success is that when I go to the doctors or attend the clinic at the hospital, that it's a good experience and it matches up to my criteria of what a great experience should look and feel like. So in summary, I would just like to say to you that in terms of the engagement programme going forward, Healthwatch Cumbria is absolutely committed to ensuring it's as involving and far-reaching as it possibly can be. That it involves as many organisations and as many community groups as absolutely possible. That it's built on what we know. That's something I haven't touched on yet, but there's a huge amount of information already in the system. We have written reports, we've got loads of data. Everybody has, lots of the organisations have that. This is not a new conversation, but it's a very focused conversation of now, but it needs to build on what we already know. We know some change is inevitable, but we will have to know and understand the reasons why and be part in the conversation that helps us achieve and agree what those changes should be. And I think the last point I want to make is that the solutions absolutely must be Cumbrian. You know, we live in a very special and beautiful part of the world, but as we know, that brings very particular challenges. And so the solutions have to be suitable to make sure that the experiences change for everybody for the better, and that the system operates in a more effective way going forward. Thank you.